the vaccine covers is tetanus. It's caused by bacteria that is found in the soil, dust, and animal feces, and it can stay infectious for 40 years. It enters the body through deep puncture wounds, for example, when you step on a nail, and the bacteria causes muscle spasms and stiffness, progressing to lockjaw and rigor, where the muscles are in a constant state of contraction. It takes about 7 to 8 days to incubate and manifest. If it's not treated, it leads to disability and death. Once the toxin binds to your nerves, there is no way to reverse it, and the only treatment
Another
is supportive.
disease that the vaccine covers is diphtheria. Diphtheria is caused by Corynebacterium diphtheriae, and that stays in the throat of the patients. It's spread through the air, contaminated objects, or by touching an open wound. It's extremely contagious. Infected people can infect healthy people for up to six weeks, even if they're asymptomatic. Symptoms show up about 5 days after exposure. General flu symptoms with difficult, rapid breathing and a thick gray membrane that covers your throat and can cut off your airway. It's treated with an antitoxin and penicillin and can lead to heart nerve damage otherwise. Prognosis can be fatal if it affects the heart, and regardless of the recovery time, it's very long and makes the patient more susceptible for secondary infections.
Pertussis, the last disease that the DTaP vaccine covers, is a very, very contagious upper respiratory infection. If one person in the household has it, it's an 80 to 100% chance that they'll pass it on to someone else in the house. And it's caused by Bordetella pertussis, which attaches to the cilia in the upper respiratory, so you can't filter out any bacteria. 94% of patients who get it who are under the age of 4 months will die, and 60% of kids who get it will be hospitalized. The symptoms of pertussis starts out just like a cold, but as it progresses it turns into a very uncontrollable cough that makes the patient's face turn red or blue, and when they inhale, that's the whooping that you get. Babies under the age of 6 months are the most susceptible because they're not fully immune to the disease until they get the first 3 vaccinations in the set. Family members with a new baby in the house should get a booster vaccine just to make sure that they have no risk of passing it on to the baby.
The Tdap vaccine, or tetanus, diphtheria, and pertussis, is usually given to children at ages 2 months, 4 months, 6 months, 15 to 18 months, and then 4 to 6 years. These 5 vaccines are all extremely important, with the last 2 being boosters to ensure immunization against all 3 of the diseases. There are other vaccinations that are approved that also include the hepatitis B or the polio vaccine in the exact same serum, so it reduces the number of injections that are required overall.
You ready to give your baby the Tdap vaccine?
Well, I'm not sure because I read on the internet that it can cause SIDS and brain inflammation.
Well, as far as the SIDS, the age that a baby can get SIDS and the age that the baby starts getting their vaccines coincides, so it's actually just a big coincidence. And there was a big study in the 1980s that showed that getting the DTaP vaccine for your baby actually reduced the risk of SIDS. And as far as the brain inflammation, it's a valid concern because they ran some studies and showed that the pertussis toxin is one of the most dangerous toxins in nature, and so 1 in every 875 babies suffered some sort of damage from the vaccine. But if you compare it, it's 0.001% chance of your baby getting it versus the 94% chance of your baby dying of pertussis if they do get the disease. So I think it's in your baby's best interest to get the vaccine.
Oh, okay. I wasn't aware of that.
Side effects of the Tdap vaccine include pain, redness, bleeding, and swelling at the injection site, headache and tiredness, nausea, vomiting, diarrhea, and a stomach ache, or chills, body aches, sore joints, rash, and swollen glands, although this is very uncommon. It may cause a fever, but even though these side effects may persist for a couple of days, it's much better than the weeks to months it takes to recover from any of these
On
illnesses.
average, the price for the Tdap vaccine can cost anywhere from $30 to $90 per dose. The physician's office is going to cost more on average compared to a walk-in clinic. To save money, try to check with your insurance or medical provider if they can offer the Tdap vaccine at reduced price for a fee. This would greatly reduce the cost for administration, even if you have to pay full price for the vaccine itself. The vaccine is available in walk-in clinics and doctors' offices.